response to changes in patient care. So what we need to do here, so we need one of those patient safety goals. It's about our patient recognition of their changes in the observation that we need to do. Okay? So what is there? So early recognition of clinical deterioration. Clinical deterioration means, there is at the back, that it refers to changes in patient physiological status that has the potential to lead to either morbidity or mortality. Morbidity means death. Mortality means, mortality means death. Morbidity means how long time the patient is getting the sickness. At the second page, I'm reading there the clinical deterioration. So for you to know what we are going to talk about is based on the clinical assessment of patient. So to know, is there any change for them? So going to with this, we are going also to refer to the observations, whether it is objective or subjective. To know to assess the patient whether they require, what response are you going to take, or what action are we going to take. So all of these level 4 topics are those documentation. So as I said, we are already in the documentation. So all of this documentation is preparing you, so when you go out there to work in a healthcare, so at least you have the idea of what you are going to document. It's all about documentation. Alright? So as I said, the clinical deterioration is referring to a change in a patient physiological status that has the potential to lead to either morbidity or mortality, and it may be anticipated in the context of end-of-life care. When we talk about end-of-life care, patient is almost dying, waiting for the patient. Those patients in like long-term care, so we are calling them as end-of-life care. And the bottom line after this, so we have the end-of-life care. Means we are going to pack the patient dead body. We are going to do that. But we did not include already with our practical, but in the levels 1 and 2, it should be there as for your information. Okay? So I don't know whether from your levels 1 and 2, did they tackle or did they discuss about the end-of-life care? No? Okay. So this end-of-life care, as I mentioned, is how the nursing assistant are going to prepare the patient who already is dead. Okay, so we are going to take care of them before they are going to be taken once they die on the patient bed. This is our role. Okay, so the same way as we are giving back to the patient who is alive, same what we are going to give to the patient who is dead. But only the difference is we are going to pack them. Pack them means all the openings should be packed with cottons. Okay? All these limbs or the extremities should be tied. Because if not tied, they are going to be stiff. It's difficult for you to fix them. Okay? So, as I said, what else there? So, together with this one, so you have to fix it the same because otherwise it will be open. Okay? And those opening, why we are putting those cottons because there are still some more of the fluids that will be leaking. Okay, so the white cloth that we are going to use, it will become wet. Okay, but definitely we are going to do this after we give them bath. We are giving them bath. Alright?
The dead body?
Huh?
The dead body?
Why? It's not to be. We are giving bath to the dead body, Shuada. Okay? Before. We are going to give bath to the alive and to the dead. This is it. So if you are in the hospital, so the same way, so you will prepare documents. So documents must be legal, must be accurate, and clear. Okay? Because if they are going to take the body, so it's the supervisor. That's why during my time when I was supervisor, I don't want there is death in the hospital. If it is only one, I can just tell them, okay, send them to the mortuary, give me the paper, because the supervisor is the last to sign, okay, before sending the dead body to the mortuary, okay? If it is only one, because checking the name, only one, no worries, okay? But if it is 2 or 3 or 4, the supervisor should come and check each one. There are 3 names, one on the forehead, one on the abdomen, and one on the feet. Okay? So you have to check the name against the medical records. So if you happen to miss, if there are 3, 4, 5 in an accident or something, and you miss that, so they will be exchanged. It is common that there are mistakes, even in our news. They are sending home the remains, and once they found out in the Philippines, in our place, they will find out it's different person. Imagine that.
Too bad.
Yes, it flown already, and they prepared it. And then only to find out once it opened, and this is not the one. Imagine that. So that's why we must be careful. Okay, so starting from us, when the dead body is going to be sent to mortuary, and the mortuary people will be the same thing to take care of that, the same strict process. Because otherwise, you will open. That's why I said, whenever there are 4 or 5 lots of, I'm very strict with that. So, because you are going to open, you look at this, you look at this. Okay? I don't like to look. This is my weakness. I don't like to look. That's why if it is only one, I can tell them, yan na. You just pack it, send me the paper to sign. Only one. Okay? There is no other name. But if it is 2, 3, 4, 5, you might. Alright? So anyway, that is the clinical deterioration. So physiological of the patient, we are going to assess. So going back, as we said, we need to recognize early our patient to prevent them from what? Preventing them to get harm. Harm means extension. Extension of infection, extension of deterioration, extension of further injury. So that we need to prevent them. So what else is there is to stabilize patient and reduce adverse events. So we need to stabilize patient. What are those assessments? We need to know, how do we know that this patient is deteriorating? You know what deteriorating means, right? When the patient already going down. They are deteriorating. The condition physically, they are deteriorating. Okay? So we need to prevent them from becoming deteriorating. So what else is there? If we fail to recognize, means to say, failure to recognize and approximately manage deteriorating patients is a contributing factor. Too many adverse events in healthcare organization. So clinical deterioration can happen at any point in any patient illness or care process, but patients are particularly vulnerable following hospitalization after surgery and during recovery. Okay? So most patients are dying during that time. After recovery, recovery means during the surgery. So once the patient is going to recover, it is very serious thing. Or it is very, what we call it as, very important for us, very serious thing. Okay? So because the patient, there is always a timing that the patient could get up to be awake after anesthesia. That's why we have lots of malpractices, or there are lots of errors happens after the patient gets surgery because of anesthesia is number one. So the patient will not be awakened anymore. Okay? So those nurses who are with those patients in the recovery area, so they are very in a critical mode of assessing the patient. Because one mistake or one did you not assess. And like for example, what we are going to assess, as I said, physiological means even the observation, whether it is subjective or objective. You should know those, right? Objective, what we are going to assess when we say objective. What observation you will do in assessing objective observation? What is objective? No, for him, he did not take the documentation.
I think it's what we see, what we hear.
Yeah. So this
we can
is,
submit.
yes. So the 5 senses you need to use when doing your objective observation. While subjective, from the patient. Whatever the patient is feeling, whatever the patient is experiencing, that is the patient's side. Okay, like I have headache, I am feeling dizzy. We cannot say it. It's only the patient who is experiencing. Alright, so what more is there? So by closely monitoring changes in physiological, so this is our role. So monitoring our patient, monitoring them in the way of objective and subjective. So doing so preventing the patient to deteriorate and gone into the most is the end life of the patient. So why we are going to prevent them is to identify the importance to reduce what? Mortality. We need to reduce the deaths. We need to reduce the avoidance of morbidity. The patient will not go, like for the patient who are diabetes. So we are going to prevent them to become like chronic. Okay? So this we are preventing as soon as immediately we are assessing our patients, deteriorating patient. We must also avoid the length of stay. Means, instead of 3 days now, the patient will be going more days in a hospital. So what else? So this will be associated also for the healthcare cost. So instead of the medical insurance is going to pay only for 5 days, it will be extended to 2 weeks. See? So all of them contributes if we will fail to assess our patients or to recognize our patients in deteriorating patient's condition. So in our assessment of patient, aside from the observation, we got 2 responses. Okay, so we have to remember that 2 responses. One, we have the rapid response system. So the rapid response system is the system that provides immediate assistance to patient whose condition is deteriorating. Okay? Rapid response system. Call it in the abbreviation as RRS. So the goal here is to intervene before the onset of injury, respiratory arrest, or cardiac arrest. So we are preventing those patients going into cardiac arrest, number 1. Number 2 is to prevent them the onset of injury. Like the patient has already like a bleeding, and it continue to bleed. Definitely, a part of this will be amputated. So, before it goes into the onset of that injury or of amputation, you have already, what? Assessed your patient. There was bleeding. So, those patients with diabetic foot, okay? So, every day you are seeing your patient and the foot of the patient is already black. And you did not notice. So, the next day, that patient foot will be amputated, will be cut off. Because there is no, it's not something that they are going to keep that leg. Because that leg is already what? It's already, it's not spoiled, what we call it. Because there was no blood anymore in that. What is the medical term for that? That's why we are amputating. It's already dead. Necrotic. Okay? It's already black. No more blood. No more circulation. So definitely, it will be out like this. How the doctor will keep it? So the patient will be poisoned. So a part of this will be cut. This is it. So it's upon us in our observation and assessment, we will prevent the patient from getting into this, all of this, onset of injury, all of this like illnesses, death. Alright, so as I said, that's the goal, is to prevent the onset of all before it happens. Now, there are a team in an RRS. So if you are in a small center or healthcare facility, you have only few. Like for example, let's say 5. There is the doctor, there are 2 nurses, let's say another nursing assistant. Okay, so maybe there are 4. Alright? So these 4, they are involved in those experiences, how to act during the time of RRS. Okay? Because we need to act, right? So what are those like, for example, as I said, like, so what are the example of this? We're in the rapid response team. We are calling them rapid response team. So a team of all multidisciplinary. So they are going to act after you recognize your patients is deteriorating. Okay, so we have one, as I said, is rapid response system. So we have the rapid response team. And what we need to assess during the RRT or the RRS, one, you will find your patient is conscious. Okay, so the patient is conscious. Second, your patient is responsive. When you say hello, 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 and the patient even cannot say anything, will just, so it's still there is a response. So patient has breathing. And the last, patient has pulse. There are 4 rapid response system. So there is, as I told you, there are 2 ways to respond into deteriorating patient changes. Second, we have the code blue. So there is a code blue team. Now, who has done the BLS here? BLS. Anybody? 1. No, not yet? Oh my God. So it's still, you are going to be in the OJT now. You are not going to OJT without all of this. So you have to ask. You have to follow up. Because as you know, this code blue is the BLS. Alright? So if you did not take it, so how you will be going with the patient? So at any time the patient deteriorates and it requires the BLS, your CPR, you cannot act. Okay? So as I said, in deteriorating patient, in response to deteriorating patient, we got 2 ways. The rapid response system, wherein the patient is going to be acted upon by the rapid response team, and what they need to assess. There are 4. 1, when the patient is conscious. Second, when the patient is responsive. When the patient has no pulse, has no breathing. There are 4. Going to the other side of the code blue. In the hospital, in a big hospital, I said, we have 2 different teams of code blue and the RRT. But in the smaller space or smaller healthcare, we have only 1 into both. So the people or the team going to act in the RRT and the team going to be act in the code blue is only 1. So you can be calling them, but the response, those people who will respond will be only 1 team. Okay? They only will know what they are going to respond. Respond to RRT, patient is somehow with the RRT condition or in a code blue condition. Now, with the code blue, as I said, code blue is your BLS, your CPR team. So code blue team, so code blue, we are going to respond the code blue when the patient is between life and death. Patient is dying now, dying. So almost gone. So the response of this code blue team, so they will assess for 1, patient is unconscious. Patient fell unconscious. Second, patient is unresponsive. Not talking anymore, not responding anymore. Third, no pulse. Fourth, not breathing. Okay, so you got now. So for the code blue, all no. And the rapid, all yes. Okay? Now, as we said, in the rapid response, preventing the patient to deteriorate, like loss of injury, death of a patient, okay? So, for example, I will give you one scenario. So tell me whether this is RRT or RRS or this is the cold blue. So there was one patient. This is a real happening. So this patient happened in my hospital. So one lady, one mama, so she was fasting. So she has chronic diabetes. So now when she came to hospital, she is going to have her blood test and to be consulted by with the doctor. So from night before she come to the hospital, she took the food before her last fasting time. So she fasted from, let's say, 12 midnight to 8 in the morning. Normally, the fasting should go in 6 to 8 hours. The more 12 hours, the more good for the result to get it more accurate. Because the more your blood is fasted with longer time, means concentrated blood, they will get good, accurate result. Okay. So now, what she did from 12 to 8, she did not eat anything. Okay? She is diabetic. Now, so when she came to the hospital, her appointment is 8 o'clock. So, after the test, she did not eat her food. Okay? So, but her insulin was given at bedtime. You remember our insulin? At bedtime. So, she had the insulin at bedtime and she did not eat. You get this scenario, huh? And the morning, 8 o'clock, she came to see the doctor. Fasting, more than 12 hours, 8 hours, not eating anything. And after the doctor has sent her to do the blood, yet still did not eat something. Okay? So she went, she said, I will go home and eat at home. So she went to the pharmacy. Now she is in the pharmacy waiting for her medication. In the pharmacy, while waiting, the pharmacist who has taken the BLS, okay? So BLS is only taken by the individual, normal individual. Okay? The ACLS is taken for all those who are dealing with the specialized area and intensive area. Okay? So now, here it comes. Patient was waiting, she gave the prescription, she was waiting, and the poor pharmacist preparing the medicine for dispensing, the woman suddenly fainted. Automatically, this pharmacist, okay, code blue. Is he right in calling the code blue? Right?
Yes.
Why?
It is between life and death because, like the scenario you have told us, she did not eat for a long time, yet she got insulin injection. So all it is between life and death because she no longer has any glucose left in her body.
Okay. What about you?
Because it was a long time without taking the insulin, and she didn't eat. She didn't because those patients with diabetics they first give them the medicine. After medicine, they have to eat. Now, when she fell down, she was unconscious. She needed to check the pulse. Yeah. They need to see whether she's breathing or she's out of breath. Yeah.
So you assess the patient. But whom did you call now?
The code blue.
The code blue. What about you, Michelle?
Yes, ma'am. The same, ma'am. Maybe the patient did not eat a long time, and then maybe she has no she has lack of energy, and then maybe the pharmacist checked the patient no pulse and not breathing and unresponsive and unconscious. That's why they called code blue.
Okay. What about you?
Because for the cold blue, madam, there's totally no. It's not responsive, no breathing. So for me, madam, this one is for the rapid RRS.
So you said no response, no breathing.
No, for the cold blue, ma'am. Because cold blue is for no breathing.
Okay. So for your situation in the scenario, whom you will call? If you are there, if you are the one in the pharmacist or somewhere there. So what you will call?
Rapid response team.
Rapid. Why did you say rapid?
Yeah, because this one, madam, because it's a long time that we do this thing, so that is the time. That takes a long time that for fasting, so it's fainting.
The patient fainted.
Yeah. So this
Okay.
one, madam, it's cost of the life and death.
So you said rapid and now it's life and death. What is it? Hmm?
Rapid response team.
And ma'am,
Okay.
already the patient is on medication.
Hmm. So whom you will call if you are there as the pharmacist? You are there in front of the patient. You are sitting together waiting for the medication, and then the patient suddenly fainted. So the patient, is sprawled on the ground, on the floor. So you will call. So all of you, code blue. You said code blue, right? Huh?
Can we call two people?
Huh?
Can we call two people because the rapid response can come rapidly?
No. That's why you need to assess. Number one is assessment. In this condition, the pharmacist called code blue without assessing the patient. I said code blue, right? He called the code blue. Did he assess? No.
Maybe
Just
from
for-
the documentation
Huh?
on the paper,
Oh,
on her paper that shows the prescription of the drugs.
okay.
Maybe she did respond from what she saw in the paper, maybe.
So we are going to base on the paper. So what we have learned is assess the patient.
And ma'am, you can't just call, but come without your assessment. You have to see the patient already.
That's it.
You can't stand there. Hey, she has fallen down. Come. No.
That's it.
Yeah.
So what I said in the scenario, you have to analyze the scenario. The pharmacist is standing there preparing the medicine of this patient. And suddenly, she fainted. And what he did, he just picked up the telephone and called the code blue. Right? This is my scenario. Did he come out to check the patient? What we need to know in our training? We need to know if the patient, number one, patient, hello, are you okay?
You okay?
Oh. And the patient, what? She responded.
Response.
Okay? If she responded, and she is what? Conscious, with the breathing, with the pulse, so whom you will call?
Rapid response.
Rapid. So the opposite, no.
That's
Code
why we
blue.
call
But why he called? Because he was panicking. He just saw, code blue. And in the hospital or in a healthcare, we have the hotline. Okay? Like for example, my hotline here is 777. Okay? That is for the code blue. So if you will dial, like for example, 666, that is you are dialing what? Rapid response. So he dialed code blue. Automatically, this code blue team came. Okay? So the code blue team came and they found to assess the patient. Patient is all with. Shameful, right? So imagine that. You are training. And in simple case, you found your patient like this, you panic and call the code blue. In code blue, you need to save your patient, right? It's between life and death. The patient is deteriorating as life and death. The other one is just fainted. We want to just act immediately. For what? To give the patient what? Give the patient, what is hypo? What is our action in the hypo?
We can check up. We
What?
hypo, that's when there is.
One for the hypo. First thing, what to do? Hypoglycemia. What first thing you do?
We give or increase.
You have to check
But
first
we
the
have to check
glucometer.
To know
Glucometer
Ah,
testing.
you are still in the level 4, no? You have to check first the glucometer because we want to confirm whether the blood sugar is already down below the normal. And our normal is 80 to 120. So maybe it came down to 60. And the patient is real diabetic. Okay? And the patient has no glucose now. So imagine that. So there came, when the code blue came, so they were annoyed. Did you assess? No, I just called. So simple, you know? So he just called without assessing because the patient is in the opposite counter, right? So he has to leave the counter, going out and assess the patient. But instead, he just called. See? So this is the difference between the two responses. So, remember the no, and the with. Alright. So, now, with these two responses now, when the team responded, they have the medical equipment with them. You cannot just go there without any on your hand. Okay? So, what we need to do for the rapid response, we will be taking our first aid kit or the first aid box. So there must be one responsible first aider. So because he knows what is there in the box, he knows what he needs to open, he knows how to respond for your RRT. So you have the first aid box. So you know what are the first aid box content? What do you think the first aid box contains?
This bandage goes.
What should be the first aid box contains? idea? What do we contain? What there was a content of this first aid?
First aid kit.
At home, you don't have the first aid. At least the minimum. Do you have a plaster
There
at
is a
home?
plaster, there's a gloves, there's a gauze, there's a betadine,
Hmm.
and
Bandages.
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 Yes.
First aid, no?
First aid kit.
Something happens at home, what you do? You will tear a piece of your clothes. If somebody got bleeding, huh? That's why we have, I don't know, in the Philippines for us, so we are, asked requirement in a home. So at least you have a first aid box. We have the first aid medicine box. In the bathroom, always we have that glass mirror. At the back of that is the box. So we are putting there band-aid. There is this scissor, agua oxinada. What do you call this one? Panlangas. What else? Cottons, bandage. And some we are putting there that Fusidin. Okay? 1 or 2 medication, Panadol. Alright? So this is what we have in our first aid box. Now, in our Code Blue, we have a Code Blue emergency crash cart or emergency trolley. So it is like, I did not complete my we are almost done.
My duty ends at 5. There was no
Yeah.
way I could come early.
Okay. So what I'm going to show you about is the emergency Okay, so what I'm going to tell you about this one. So when we are going to respond to emergency, Code Blue. Okay, so emergency trolley is what we need to bring. So all of those Code Blue team, so they have the responsibility. So these 2 nurses, one of them, if you are on duty with the Code Blue, you need to go and bring the Code Blue, the emergency trolley in the place of Code Blue. Okay, so we have individual responsibility. So look at this now. So there is a complete. So what do we have there? This one. What do we call that one?
The yellow container?
This one.
Vital signs machine.
Vital sign monitor, and there is an AED connected with it. That is the defibrillator. So we have normally the AED. Who have the, you have taken your BLS? Not yet, okay? So normally, on top of this, there is that red band. That is the AED. That AED is the automated external defibrillator. So we are going to use that when the patient stops heart beating. Okay, so there is an automatic assessment whether the heart requires defib. Okay, so the same way here, at the side, on the opposite side, it was not shown. There is your tank of oxygen. And on top of this, it is not shown at the back, behind it, our suction portable. There must be all of this. Because we are coming to the patient on this scene. So, you need, if the patient requires oxygen, you put the oxygen. If the patient requires suctioning, you need to suction. They are all AC/DC, means it doesn't require electricity. So as long as it is battery operated and that battery is, what is this? Charge. Okay? So the whole thing, all of these drawers, so everything is there. You have the syringes, you have the cottons, you have the packs of dressing, everything is there. So, emergency throwing. Okay? So you know how to distinguish. During your exam, you will know how to answer your scenario. Okay then, so what else do we have here? So as I said, we know already how to respond using our observation with going to use when there is a code blue and there is a rapid response. So when to call a rapid response? When are we going to respond to patient with a RRT or rapid response? So we need what? We need to assess what? Just remember your vital signs. As we said, your physiological assessment. That goes with your vital signs. So you should know exactly the normal values. How you will respond if you don't know that the respiratory is already what? 12. Below 8. Okay? So you know what to do, right? So we need to follow, or we are going to have our rapid response with assessment of our vital signs. So what else with that? So we need to know vital signs, right? Our heart rate, respiratory rate, oxygen saturation, blood pressure. So what will be the assessment? You remember the assessment? We have the 3 assessments. 1, pain. The pain phases assessment. 2, the Morse fall. Whether the patient will have a potential to fall. And the last, GCS, the Glasgow Coma Scale, when the patient has brain injury. So going more in the patient assessment, we not only check on the patient parameters like the vital signs, and we don't also limit with our assessment of whether it requires RRT or the code blue. So we need also to check whether the patient is already dehydrated. So dehydrated will give your patient what? Shock. Imagine. So the patient is going to be hypovolemic shock. So loss of or lack of oxygen and lack of blood plasma. So the same thing, the patient will go on shock. So what else is there? So you need to check your fluid balance. How to check the fluid balance? So for us, especially the doctors, number one they check is on the tongue. That's why when you are going for your examination, the doctor will ask you, can you, and then he's going to stick that spatula on your tongue and scrape a little so that he will know whether it is dehydrated when there is no fluid or no saliva. Alright? So even your skin, you scratch your skin. So we will know whether it's dehydrated or no. Scratch, I said scratch. Scratch in a long line like this. And it will mark. Means it's dehydrated. Alright? So it is the tongue and your skin is the thing that we need to check. What else? Your respiratory value. So when the patient is having what? Difficulty of breathing, shortness of breath. So you will know that this patient is deteriorating. What else? If the skin color, your patient become pale. Okay? Or flashy red. So, it depends again. Right? So, presence of sweating. Sweating. So, you will find it with your patient in diabetes. So, what else? Patient with rigor. Stiffness. Your patient is already like this. Okay? So, they are deteriorating. So, what else? They are vomiting. They are nauseated. Other neurological signs, our GCS assessment. So what do we do there? We assess our eyes, verbal, and the motor. So don't forget about all this. So in the measurement, we need to measure our observation. So then, we will be the one to check our observations by what? If the patient seems like febrile, so we need to check the oral or temperature. If the patient has difficulty of breathing, definitely we check the what? Respiratory rate. So for the blood pressure, our pressure, it's done, it's less or higher. Glucometer also, we need to check. Okay? Because there are patients, if they are diabetes, patient can hypo or hyper and they could die. Extreme. Okay? The blood sugar that is already 500, 600, you will see. Okay? And those patients with the hypo, lower than 60, 55. So, you have to be better, be very careful and alert. Your temperature, your level of consciousness with our GCS. So what should be the roles in recognizing and responding to patient clinical deterioration? What is your role? What is your role now? So what will be our role? What will be your role now that we discuss about deteriorating, how to respond to deteriorating patient? So number one, you should remember what? Assessment of your patient. You need to assess. You do not just call like the scenario that I mentioned. The scenario that I mentioned, so the pharmacist just conclude that the patient requires code blue. and the patient doesn't require. So during that time, as I said, so that was a time when the Department of Health or Health Authority sent us a memo to all the healthcare. But definitely that is focusing on us because it happened to us. But instead, the Department of Health or the Health Authority, he just gave it, implement it, compliance of all. And it is written there, reminder to all healthcare professionals. You should, number one, assess your patient in what? Response to your deteriorating patient. Okay, number one is assessment. So, number two, so we need to undertake what? Your vital signs measurement. Assessment, we need to do it as in physical, physiological. We discuss about it, all physical. It also covers your observation, your objective and subjective observation.
Madam,
Yes.
you say number one is assessment, but the number one I have here is measuring and measurement.
That's why I'm just giving you that I have already, this one is updated, but I did not update it here. So number one should be assessment. Number two is measuring. I told you the measuring, right? So the number two is measuring. Because that happened to the patient, as I said with the scenario, he just he just called the code blue immediately. But without assessing, he had a mistake. So because the patient, instead of calling the rapid response, he called the code blue. And the patient is all with the rapid response observation. All with the with. Conscious, with. So what else there? So we need to identify. So after the assessment, we need to identify, right? We need to identify what exactly we need to act upon. You need to identify now. So the patient is what? The patient is hypoglycemic. So the patient, you identify that the cause of is hypoglycemia. Okay, so it depends. So maybe if the patient has bleeding, so that will be the cause of your identification of your problem.
So, madam, this number 3 is okay.
You write what I'm saying now. Okay, 1, 2, 3, 4. All right? Identifying. So assessment is number 1, right? So number 1 is your assessment of clinically deteriorating patient. So number 2, you have to measure. Measurement of all your parameters. So number 3, by using your observations, right? So number 3 is identification. So together with all of your physiological, that will be with your measurement.
Identification of?
Identification of what problem you will be getting from your patient. So if your patient has no breathing, so you have to identify that the patient requires what? No breathing, it depends. If it is code blue or if it is rapid response. Code blue is without breathing. So without breathing, you will start your BLS, your CPR. So if the patient is breathing but has difficulty So what you will administer? Oxygen. See now? Your mind should supposed to be with what you are assessing your patient. You cannot just jump like a patient requires oxygen. Did you check your parameter? Did you check your oxygen sat? To confirm? No. So you need to check. So what else there? So if ever, like you are there, so now you have identified all of this, you have a problem now with your patient deteriorating, you have to escalate your care to your nurses. Do not go to your doctor. You remember your chain of command. So who is, over you? So you do not bypass your nurses in reporting your patient. Okay? So reporting your patient, you have the chain of command. Chain of command means who is next to you, you have to report there. It's not like you have seen the doctor and the doctor, we are going now. Okay.
Madam, can I just say something?
Okay, say something.
Yeah, but sometimes for us, sometimes duty ends at 5 and the class starts at 5.
I will tell you, okay.
We find ourselves in a very, very hard and very challenging situation. So this is for myself, I find it really hard to come in time. So it's a
I'll
bit
give
of
you
a-
an advice. Okay?
Yes.
You are not the only one. I have lots, or we have lots of students who passed the level 4 already. Only one day, Saturday, 5 to 8. They managed to change all of them. So for you, that will be your individual challenge. Okay? Because all of you. So they finished. They said they were fighting in the reception. If you know them, Scott is number 1. You know Scott? So he was with you maybe in the last group. He was fighting. How long he was fighting? Since he was with me in the practical. Mom, I cannot. And then he was budging around all these people in the reception. I cannot. And even that last time, he went with the CEO. So Mama Ricard came here with me. And finally, now, he graduated.